If the viral load in the blood is high, the liver is inflamed, and there is even fibrosis. These are high-risk groups for liver cancer. Hello, everyone. I am Dr. Liu Yucha. Welcome Dr. Chang Wanlong to the Care Online. Hello, I am Dr. Chang Wanlong. How is hepatitis B transmitted? The hepatitis B virus is transmitted through the patient's blood or body fluids, infecting through wounds. So, in daily life, eating with someone who has hepatitis B does not transmit the virus, unless there is bleeding, and contact with an open wound, allowing the transmission of blood. What is vertical transmission? Vertical transmission, also known as mother-to-infant transmission, occurs when a mother with hepatitis B infects her baby during childbirth. When the mother's blood comes into contact with the baby becomes infected with the virus. This type of transmission accounts for approximately 40% to 45% of hepatitis B infections. If a mother is a carrier of hepatitis B, what is the probability that her child will get hepatitis B? It depends on the viral load in the mother's blood. If the mother's viral load is over 1 million per milliliter, the chance of transmitting it to the baby is high. In our country, since 1984, if a mother has hepatitis B, the newborn will receive a preventive vaccine. Starting in 1986, all newborns receive the hepatitis B vaccine. Recently, in addition to the vaccine, infants born to mothers with hepatitis B also receive immune globulin to prevent infection. What is horizontal transmission? After the baby is born, exposure to the hepatitis B virus may occur due to medical interventions or contact with contaminated blood. For instance, in the past when disinfection practices were not optimal, procedures such as injections and dental treatments, as well as traditional practices like acupuncture, cupping, scraping therapy, tattooing, and ear piercing performed during adulthood, could potentially lead to the transmission of the hepatitis B virus. If the equipment is not thoroughly sterilized, there is a potential risk of infection from the virus present in the blood of the previous patient, as it may enter through wounds. Additionally, it is crucial to note that engaging in sexual activities also poses a risk of transmitting hepatitis B. 30 to 40 years ago, we often encountered cases where patients presented symptoms resembling acute hepatitis or fulminant hepatitis. However, upon admission, it was discovered that the individual had contracted the infection due to marriage, with their spouse having hepatitis B. Consequently, mutual transmission occurred, leading to the manifestation of fulminant hepatitis. At that time, this type of hepatitis, resulting from sexual activity between spouses after marriage, was referred to as honeymoon hepatitis. This phenomenon was occasionally observed around 30 to 40 years ago. However, cases of honeymoon hepatitis are no longer encountered nowadays. One memorable case was a 50-year-old male with hepatitis B. There is the presence of the virus in the bloodstream. The liver function indices are unstable. He was thinking that if his condition remained stable, there would be no need for treatment of hepatitis B. However, we routinely conducted examinations on him and found that his viral load remained elevated. Moreover, after a certain period, abnormal liver function would manifest, and ultrasound examinations revealed evidence of liver fibrosis. After 3 to 4 years of convincing the patient, it was only when the patient was preparing for treatment that the presence of a liver cancer was discovered. For patients with hepatitis B, particularly males aged 45 and above, if there is a higher viral load in the blood, along with liver inflammation and even fibrosis, they fall into a high-risk group for liver cancer. It is imperative that we actively treat their hepatitis B to prevent the occurrence of liver cancer in the future. Thank you, Dr. Chang, for joining us at Care Online. Until next time, goodbye, and thank you.